Committee meeting order to order, please save me, for Tuesday, September 27th, 2022. If we can get a roll call, please.
Mr. Lear. Present. Mr. Hess. Ms. Polk.
Present.
Ms. Weber. Ms. Parker.
Present.
Mr. Fairfield.
Present.
Mr. Carrico.
Present.
Mr. Featherling.
Present.
Mr. Miller.
Present.
Mr. Long.
Present.
Mr. Hunter.
A little time for bacon.
Ms. Foster.
Present.
Mr. Wheeler.
Present.
Mr. Seroy.
Present.
We have a quorum.
Says I have a meeting coming.
We have a quorum. Do we have any public comment today? Somebody stood up in the back there? No, sorry. No public comment from Anita. Approval of the minutes, August 23rd, 2022. Is there a motion?
Polk.
Ms. Polk, Mr. Fairfield, all those in favor say aye.
Aye.
Those opposed, same sign. Motion carries. Mr. Lear, anything under legislative today?
I have nothing.
Alrighty. Don't have a whole lot of updates. I know that the Senator Joyce was working on a trailer bill, hopefully for the Safety Act to introduce, and I believe it's in the veto session is what they're talking about. So more to come on that, I'm sure, from his office when that happens. So that's been talked about publicly, so that's nothing new. So under information services, Mr. Duval, you have anything today?
Just want to make sure I'm here available for any questions. As usual, we're on budget. We finished the project with the state's attorney that I spoke before, so this building's completely covered with security cameras in all the public spaces. In addition, we had an issue where we had to replace, or we're in a process of replacing a server for the state's attorney. They filled up their existing ones, but we always have that in budget in case there's a various departments. So we're taking that time to virtualize their server. Has nothing to do with their new software coming to there. This is just their local files. They fill that up with the videos that they do for courts. Judicial, we're moving forward as I discussed in the previous meetings, expanding into the courtroom with the wireless. It has to be one at a time. We have to wait to see when there's one that's opening that gives us, when they're not having a court case, and for sufficient time to be able to get in there and do it the right way. We've prepped the wireless unit, so most of them have already been set up, so we can just get in there, put them on the wall, and then get out of there, so we're not just starting from scratch in the room. So we've got that process going. And with finance, we had a semi-emergency happen with finance with their server. Their latest update, we do all their updates for the finance server for the MIP software. This latest update we couldn't just apply.
Technology.
Siri is not a member of this community or committee, excuse me.
You should reach your destination by 11:24.
Okay, I don't know where
do
to
you have a
go.
taser?
I'm trying to disconnect this.
He's got a Betamax at home. It's flashing
I didn't
12.
even have a map on it. I don't know what happened.
Thank you.
Dunkin' Donuts is open.
I'm glad we solved that issue, Mr.
Okay,
Mr.
and
Duval.
the finance server, we had to replace their server. Their latest update wouldn't allow us just to update it. It required a new version of the operating system, so we had to create a brand new server. It's something that I had scheduled for the beginning of next fiscal year. What I did is just moved it till now, and I'll take a project the way we'd have done in the last quarter, move it and replace it, so it should be a net effective. We knew we were going to do something, not for this reason. We just switched it around like anybody would normally do. It took some time. I believe they noticed that some of the reports were coming out a little flaky. We made that move. We took that time to virtualize it too, so they've got a better server, a newer server. They shouldn't have to worry about it for years to come. So other than that, we do the normal maintenance, the things, the calls we get, fix a printer here, fix an OS there, fix the operating system, and all that's been working pretty smoothly. I don't know if there's anything else you want to address, or
Any questions for Kevin? IS related? I did have one. You brought up something, and I'd never thought of the courts is this. When you mentioned video, Safety Act is going, you know, with the body cameras, there's a lot of video now, and we're accounting for that cost in the sheriff's department, but are the courts going to need extra servers to store all of this, or have you had those conversations with the chief judge yet to see how they're, and even state's attorney, what infrastructure are we going to need there?
We've only had to be involved, when I say videos, it's specifically the state's attorney. I'm going to be careful how far I go with this because I want to speak on their behalf.
Sure.
When the current Jim Rowe came in as the state's attorney, he expanded the use of video as evidence. So most of these come from outside sources. So if there was a crime somewhere and there was a security camera, same reason why we have it, they take that footage. Well, they really use that a lot. So those come in, they have a system that they use and they're actually storing it. Well, that took up some of the stuff on their existing servers for the other files. It's something they need to do it, but that's more specific to that department. I haven't had any of the requests for the other ones, but I don't know. They very much could. I just couldn't tell you. With the new things that we're going to go through with new software, I expect them to discuss that more, but the demand has been for the state's attorney because they've expanded that. They have far more videos than the previous administrations have coming in.
Public defender?
No,
because they've got to have this video as well.
It's not been, we've not had any issue with them. It was the state's attorney. Now remember, a lot of these are working, the equivalent to working documents, so they may not make it to the courtroom. It's for them to decide whatever they're going to do. We don't know why, we just have to account for the space that it takes up.
I asked because of budgeting. Are we going to have to go out and buy a bunch of servers because now they're going to have to save video for X amount of years as required by law? You know, I don't know those answers, so I'll have the conversation in the background.
Right.
I just was hoping that you might have had that.
That would more come from them, but now that we have newer versions of things, it's easier to expand those existing ones as needed because we virtualized it. Before, when it was hardware, you had to get a new server. This one we were virtualizing, and then it's somewhat easier to expand by adding additional hard drives to that and remapping it. But I don't want to speak for that office.
Gotcha. Any other questions? Thanks, Kevin. Appreciate it. Health Department, Mr. Beavis.
Good morning. Good morning. You have my report, hopefully. I wasn't able to get it completed until shortly yesterday afternoon, so I apologize for that. I'll just quickly go over a couple of things that were there. A number of the items continue to just roll over from month to month. As of yesterday, Kankakee County is sitting at 33,575 confirmed cases of COVID. We are now up to 378 deaths. That's an increase of 4 from August 19th, so from a month ago. We are back down to a low for community transmission, so that's good. We've kind of roller coastered the last 3 to 4 weeks where we've been low, then up to medium, then back to low. So we're back down to low, but I think that's because we're sort of closer to the medium number range than we are the low. But the numbers the past week have plateaued to where I think hopefully we'll be at low for a few more weeks, if not maybe for a while, and then we'll just monitor as we get into the colder weather and people get indoors. Obviously you're going to have a lot of congregations, and with less mask wearing, people not getting vaccinated anymore in terms of original vaccinations. Mostly it's just boosters. We'll just have to wait and see what kind of new strains or variants may come out of that, and what we'll be looking at in terms of COVID cases in the fall. Hopefully they'll stay where they're at now. We're continuing to hold our walk-in clinics on Tuesdays and Thursdays. We've added flu vaccines for that, so anyone who's interested in flu vaccines, you can also come and get those. We also have pneumonia shots if you're interested in that and eligible. We still only have the one positive monkeypox case from over a month ago. We're continuing to post information then on our Facebook and our website regarding information there. September is National Childhood Obesity Month. It's also National Recovery Month, National Cholesterol Month, National Childhood Cancer Awareness Month, and there's probably some others in there that we're missing, but we're putting out a lot of information on our Facebook in regards to just education and resources for people when those topics come up or that specific day of the month comes up in regards to that remembrance. And then some outreach activities. Last Friday we had a car seat inspection by some of our certified passenger safety technicians at the health department. We did that during the course of the workday and went into the evening hours up until 6 p.m. to help accommodate maybe some individuals who can't come during the workday. We were able to do 15 inspections, and we gave away 8 car seats, so we were real happy with that. We'll probably have some more of those in the future. We will be doing an educational booth and opioid education on Monday, October 3rd, I believe that is, at the library as part of a health fair that's being put on by them, St. Mary's, Senator Joyce, and Representative Jackie Haas. And then we're going to be sponsoring the 2022 Teen Conference next Wednesday at KCC. That's an annual conference that we host with a number of agencies and their assistants throughout the community. Usually there's about 200 plus junior high students throughout the county that will attend that, and they will see a wide range of presentations regarding things like bullying, drinking and driving. There's an inspirational speaker and those types of topics. So that is what's going on right now this month at the health department. Any questions?
Mr. Hunter?
Thank you very much, Mr. Chairman. Mr. Beavis, is there any, pardon me, any reason why we're kind of still at 51% in terms of our county people being fully vaccinated? And a couple other questions. Did I hear you say that you were giving away car seats?
We do have car seats to give away, yes. So if anyone is interested, they can contact the health department and they can speak to some of our health promotion coordinators who are involved with those grants. And if they're eligible, we have 2 different programs. One is through the WIC program, that's the Women, Infants, and Children. Those car seats are a little more tied to some federal guidelines and conditions that people would have to meet in terms of income eligibility. But we do have some other car seats that are available to anybody. So mostly individuals who contact us, whatever category they would fall into, we can do an inspection of their vehicle. They can bring us their existing car seats. If those are outdated or broken or they don't have any, then we are able to give those out.
I remember back when I was an alderman, and we had a summer fest every summer, and the sheriff's department, specifically Chad Gessner, would come out and provide car seats to people out there, and the only requirement was that I think all they had to do was sign their name. But I think I heard you articulate that there's certain guidelines and income requirements for some of these car seats. Can you give me a ratio in terms of the general giveaways without any requirements and those which require federal people needing to adhere to certain income guidelines?
I can't at this point. I would need to go back and get the information on the WIC program car seats in regards to what are the eligibility requirements there. Mainly those are going to be individuals that are enrolled within our WIC program.
Okay. For example, during the summer and of course fall now, I would think that maybe you want to consider at some of the venues, like County Fair, they had this Oktoberfest up in Mantino, Pembroke Days, other different venues, and where there's lots of people of all particular income areas, levels, and maybe that's something you want to do as opposed to people having to come to your office. I'm not saying that they don't have to come to the health department, but some outreach in terms of car seats would be advisable to disseminate or give away at various venues. So there's something to think about. Additionally, is there in particular with the new strains and so forth, we're still stuck at 51%. Is there any reason why?
Oh, thank you for circling back to that. That was your first question.
Right.
The best reason, the best answer that I can give at this point is that nobody out there is interested anymore in getting vaccinated. They've made their decision. They're on this side of the fence to get vaccinated, or they're on that side of the fence to not be vaccinated. Most of the vaccinations that we see now are booster shots, especially since this new the bivalent vaccines came out for Pfizer and Moderna that have the Omicron variants within them, which is what they're indicating is going to be prevalent this fall and into winter. So it's, you know, I said a number of months ago, I thought it was going to take us probably by the end of the year before we would hit 52%. And now I'm beginning to maybe think about stretching that to spring, because we're only increasing by 0.01 to 2% a week.
And you indicated that people are still dying from this stuff. I thought I heard you say 4.
4 since last month, yes.
Okay. Okay, thank you.
Mr. Carrico first, and then Mr. Lear.
Thanks, Mr. Chairman. Mr. Beavers, since the health department has hosted the wellness clinic on October 1st, could you speak a little bit on that, and if we still have any open appointments available so the viewers can take advantage of that?
Thank you. Yes. So the health department has a grant. It's an adolescent health grant. And through that grant, we were able to, one of the deliverables that we came up with when we wrote the grant were 4 adolescent health clinics throughout the year. The first one is going to be this Saturday. They are rather, well, let me read here. We're going to be hosting an adolescent wellness visit clinic on Saturday, October 1st for Kankakee County adolescents ages 11 to 21. I know we're receiving some individuals on Facebook saying, well, you know, 18 to 21 aren't adolescents, but the grant allows the age to go up to 21, so we're including those. That is why we have that age range from 11 to 21. This is a comprehensive appointment to complete your adolescent school physical, immunizations, point of care testing, and or additional screenings. So this is designed because October 15th is typically that date that the schools, once schools open up, your children have to be immunized, and if they're not by a certain date, then theoretically they're supposed to be kicked out of school. And typically what happens is on October 16th, everyone starts calling the health department and their doctors saying, I need to have this physical. They wait until after when it becomes an issue. So this is designed, we specifically put this clinic on the 1st to help allow those individuals that have waited this long to get those appointments. We specifically have reached out to District 111 and some of the other schools with vulnerable populations to allow them. We can only have 40 appointments because these take about 45 minutes each, and we have to do these physicals. And in addition, if they're going to need any vaccinations or immunizations, then that's going to take a little bit of time. So we have the appointments spread out throughout the course of the day. That's why the appointment is necessary in regards to this. We're not accepting any walk-ins. And then we have Illinois State University is coming in this cycle, and then we have ONU that's going to be coming in on, ISU will be coming in on 2 cycles, and ONU will be coming in on the other 2 cycles with students, and then we'll be supervising them with our staff as we go through these appointments and do these from 8 o'clock to 5 o'clock on Saturday. Does that answer your question?
Yes, sir. Thank you so much.
Okay. I'm glad I pulled that up because I thought somebody might.
Mr. Chairman.
Yes, sir.
I'm sorry.
Can I go with Mr. Lear first? He had his hand up
Yeah, he said he did.
first time.
Okay.
Yeah.
Thank you, Mr. Chairman. Circling back to vaccination rates, do you have information on what other counties are experiencing in terms of vaccination rates?
not with me, but I can make that available. I can tell you, Mr. Lear and board members, that, earlier on, Kankakee County was definitely bringing up the rear in terms of getting started with the vaccinations. However, remember also, we weren't receiving what I would think a fair share of the amount of the vaccines at the beginning compared to other counties. And so they sort of got a head start on us. And so their numbers, and especially counties with massive populations like Will County, DuPage Lake County up north, they've got more resources, more people, more health departments and health facilities within their communities to get people vaccinated. As a result, we lagged behind, as I started to say. Slowly and surely, we have crept ahead. So I feel that now, in looking at all the numbers, and I can get you those, they're on the IDPH's website too. You can just go to the portal and look at that and see what you can click on every little county and you'll see what their percentage is. For example, at the beginning of the outbreak, Adams County was the one leading everybody. They just whooshed right up there to 50+%. We're actually ahead of Adams County right now in terms of our number. They plateaued out. Nobody anymore over there is getting vaccinated for their first initial series, apparently, and they're only doing boosters. So that's where most of the state is at this point. So we have climbed that ladder, and before we were down at the bottom third, we are now probably entrenched in the 50% area. So around this region, there's many counties that we are ahead of, and then as you go to the north, obviously, then they're ahead of us.
Mr. Hunter, anybody else first time? Mr. Featherwing,
Is there
sorry.
going to be another?
Thank you, Mr. Chairman. Is there going to be another vaccine available later in the fall, like in November or December? I was told. I don't know. Is that true
That
or not?
vaccine's available now.
So, but I mean, as far as a newer, updated one for the different.
Not that I'm aware of. This is the most current one. It just came out a few weeks ago.
Okay.
It includes the Omicron and the BA.5, and it's available now. I know that we have it at the health department, and I think some of the pharmacies have it. So anyone who is interested in that booster shot, I highly recommend you come in. You don't need an appointment.
Okay, thank you.
Ms. Foster.
Mr. Beavers, how is the flu shot going as far as people coming in getting the flu shot?
I would have to get back with you on that. I know that we've been doing the flu shots for, I think we're in our third week now. Mm-hmm. I know our clinics on those Tuesdays and Thursdays, and part of that could be because of the boosters, have seen an uptick in the number of individuals coming through. But I've not been keeping track necessarily of the numbers. You are eligible and able, if you ask, to receive both the flu in one arm and the COVID-19 booster in the other arm at the same time. It's also recommended if you want to wait, you could wait, but it saves a visit. You can get both at the same time at this time.
Anyone else first time? Mr. Hunter.
Yeah, thanks again. Mr. Beavis, would you be willing, I don't want to put you on the spot, and I'm pushing towards this outreach thing in terms of accessing community needs. I've served on several different boards, and I was wondering about maybe a partnership with Hippocrates Clinic, NAACP, and Hispanic Partnership. Would you be willing to allocate car seats to them for dissemination in the community? Because we have people at Hippocrates that come in all the time. NAACP, we talk to everybody. And Hispanic Partnership, there's a venue or there's an avenue for assistance as well too, to get rid of some of those.
I am open definitely to a conversation between the groups to discuss the potential. Okay. I can say that the health department has been out to the community on a number of occasions with the car seat program. Last year we were at the Touch the Truck event that the Park District put on down here at the park by the river. And we've also been to the farmers market on 2 occasions with a number of other educational events at that time, in addition with the car seat program. This one just happened to be at the health department in conjunction with, as I said, part of the grant in regards to what they were trying to accomplish. Part of what we have to consider is, obviously I have staff that are working Monday through Friday, 5 days a week. If we go out into the community for a number of other events, those are going to be either in the evenings or on the weekends. I have to be cognizant of burning my staff out, especially in today's climate after coming out of the last 3 years with the work that they did do and the number of hours that they did put in there. So we are being careful where we go, and I would rather, you know, work with communities such as what you just added, not saying that others aren't necessarily deserving either, but obviously if we're going into, you know, Kankakee or District 111 or out to Pembroke or Sun River Terrace to potentially hand out car seats, it's a little bit of a different avenue than, you know, going out to Bourbonnais or Mantino, where maybe that's more affluent and those individuals could afford more than what we're trying to accomplish. So we can definitely look at those types of things in terms of the population and the seats that we have. We have a number of seats, you know, that they are limited, but I think we have approximately 100 seats on one of those programs and 60 to 100 for the WIC program, which is the one that's a little more, again, you have to be a WIC client, and then there's some categories of the income levels in regards to that you have to meet. And that's because those are federal rules that come down through that grant as to why there are stipulations on those seats versus the other ones we can give out to anybody. But we do want to be careful who we're giving them to.
Will help. Thank you.
Mr. Seroy?
Thank you, Mr. Chairman. As far as the car seats, wouldn't you think that the 2 hospitals would be your startup points of when the infant's going home, do they have a viable car seat? And, you know, that would be the place to start with, you know, the availability of car seats for infants riding or
definitely
child, you know. And I don't know if you probably do reach out to those people or have somebody in the OB section of the hospital say, hey, you know, hey, health department, send over a car seat because we've got a family that's going to bring home an infant and they don't have something.
We aren't able to just send over the car seat. The individual, the family, the couple, the caregiver has to come to the health department ultimately to then receive the car seat. We can inspect the car, we can teach and educate them on how to put it in correctly, and then it takes about 45 minutes to do those inspections, so to speak.
Because I don't think they'll let anybody go home without one.
They shouldn't, but I believe that it happens because we actually, so the staff at the health department that are involved, the certified technicians are in communication with the hospitals. The hospitals, I believe, have some technicians, or at least used to have technicians themselves. However, you know, they're obviously over here working on this side of the fence and aren't giving away car seats per se. So we work together with them. If an individual is identified and does reach out to us, then they do come. We have had individuals that, you know, arrive at the health department with no car seat and they're carrying a baby in their lap. That's just the way of the world.
Okay.
So, but those are the individuals we are trying to reach out. So that is a great point, and that is something we work with the hospitals. We have collaborative relationships with everybody. So, you know, but do people, you know, fall through the cracks? Yes.
My second question on the vaccination rate, how many, you know, just throwing a solid number out there doesn't really do me a lot of justice, because how many are population in our county are under 18 years old? What's the population of adults? What's the population of 65 and over? What's the population of people that are in the category of needing the vaccination?
Okay, I can bring those numbers next
You know,
month.
so that's the 51%. I mean, there's a lot of people in there that, you know, a lot of children, I would say, in that 100% category.
Well, that 50% is probably top heavy with people that are 50 and over that are vaccinated. The children, with that being just recently eligible, is woefully low.
Right. So you're going to have a number there that's going to be astronomical anyway, just because your population of children in your county is probably at least, I'd say, a quarter, 3/8, or maybe a half of your population would be under 18. Right. I'm not sure, but that would be the numbers that I would be interested.
I can get those numbers and have those available next month. Obviously now, 3 years outside of the beginning of the pandemic, when we didn't know anything from day one, we can see that anybody can get COVID, even if you're vaccinated, and that predominantly it impacted older individuals that had comorbidities.
Yeah.
And that predominantly most of those are the individuals that passed away. But there are others in all those other age groups that were impacted, got COVID, and died also.
Yeah.
So that's the point here. But at the beginning of this, obviously we didn't know. And so that maybe ties into Mr. Hunter's question earlier as to why are we still at 51.8%? It's because I think people are educated now and they're making the decision that the risk is not as great for them, and so they're willing to live with that. Versus if I'm 80 and have cancer and undergoing treatment, and if I want to make sure I don't get it from somebody, at a county board meeting, for example, sitting next to Chairman Wheeler,
Sorry.
I'm going to wear a mask when I go out into public.
Thank you.
We have a lot better tools now in education than we did at the beginning of this.
Any other question? Oh, Mr. Carrico.
Thank you, Mr. Chairman. Mr. Beavis, could you speak briefly about on the new board members of the health department, the Board of Health, and how are they doing, and you know the work generally that is performed by the Board of Health?
Well, the newest members are Dr. Fry and Catherine Hamblin. They've been active for 3 months now, I believe. So I believe, and then one of the new changes to that the board members voted on last month was similar to what you have here at the county board level, is the ability to attend via Zoom. So there were some characteristics and definitions put in place so that not, you know, we have to have a quorum, obviously, to allow for individuals to Zoom in if they are unable to make the meeting in person. Typically, the board members review, similar to this. I give my administrator's report. We have some other reports from the Environmental Health Division, the clinic side in regards to that, and then Aaron, our fiscal manager, goes over either the previous months, or sometimes if we've had an issue or something wasn't ready, we may have 2 months worth of fiscal numbers to look and be approved by the board. And then, you know, for example, last month, then we approved the budget for 2023. And then if there's any personnel issues or other issues that come up that need to be discussed, then those are usually the things that get talked about at the meetings.
Okay, thank you. Additionally to that, how many grants, you know, we are working with right now in terms of the health department?
That is a great question. We have approximately 28 grants that the health department is involved with that then covers a gamut of programs. I'm actually putting together stuff. There's a chamber meeting coming up here in a short period of time. I've been asked to give a presentation on the health department, so I'm putting something together as a result of that. You and I have discussed, and I'm trying to prepare for, you know, all the board members, sort of a Cliff Notes cheat note version of all of those 28 grants, their titles, and then what exactly are the programs or the services that the health department provides. Many people think when you say health department that all we do is make people wear masks and get vaccinated or contact trace. And I can tell you that before COVID hit, we had about these 25 grants. Now it's up to 28. There's so many different services that with 110,000 people in this county, we touch the lives of everybody in some form or fashion, whether you walk in our doors or not. So that's what I'm trying to put together. You know, thank you, Mr. Carrico, is our president of the Board of Health currently. And he and I have discussed this, and it's just trying to get that information out there now as COVID kind of falls off and becomes more of something that we consider normal, like the flu, that we can get back to promoting all of these other 28 programs and activities that we do, such as, you know, car seat program and giveaway and outreach, and then the other programs that we do on a day-to-day basis that many of us take for granted. You know, you take for granted from what we do. I take for granted from, you know, what you and your businesses are.
Thank you very much.
Anything else? Thanks, John.
All right, thank you. Have a great day, everybody.
Mr. Petkunis is not here today, but the quarter report, need a motion to put that on file. Mr. Lear, second. Mr. Long, all those in favor say aye.
Aye.
Those opposed, same sign. Motion carries. VAC, Karen Smetansky.
Good morning.
Morning.
My reports are attached, but before I start, so I don't forget, since you all come from a wide range of the county, I'm going to ask for some help. We got a letter in the mail that just has names in it and no contact information, and we don't have this person in our system, so I'm going to see if any of you know them. I won't give out information what they're looking for, but does anybody know? The veteran himself is deceased, so they're looking for some help for the widow, but the veteran's name is Robert Earl Gates Sr., and the wife's name is, I believe, Lossie, L-O-S-S-I-E, maybe, May Gates. We got a letter signed by, I'm going to assume, the daughter, Kathy Gates Washington. Anybody ever heard of them at all? That came
Yes, I have.
You have? You know who they are? Okay.
Yes, I do.
Can you call our office and maybe get me in touch with them? Get me a phone number for them so that I can get in touch with them?
Yes, ma'am, I will.
Oh, thank you so much. I knew this was the right place to bring it to. I searched Facebook and I couldn't find them, so I thought, well, you know, let's see what we can do here. Wonderful. Thank you so much.
Welcome.
Beautiful. Reports. We have actually 8 in Veterans Treatment Court now. We have, so this is last month's report, but we have 8 in court, 3 more referred right now, and everything is going well with court. We do expect Judge Kramer is retiring in October, so Judge Jones will be taking over. And our project Headspace and timing, Heroes, Hogs, and Hot Rods went really well. Our numbers came out. We raised about $15,000 on a 105-degree day. I just got back from our annual state training in East Peoria. Had a great week down there of doing training with our state county VSOs. We also had some of the state veteran service officers with us. We're doing some collaboration with the state veteran service officers. That was very well received, and other than that, our reports are attached. Any questions? Oh, we're set to move, I hope, in November, open house on Veterans Day, November 11th. I hope that's all in the works anyway, so.
Questions? Okay. Thank you. So next up is it's kind of a discussion of there's a new law for the VAC that takes effect on 1/1, and we've had some conversations going back and forth with VAC. Met recently as yesterday to kind of hammer out some things. So I thought it was a good measure to come in here and kind of discuss this in the realm of what the law says, what the impact will be, and what the timing of that is. And so I asked Mr. McCarty to put together the financial side of this, and then the state's attorney's office has been involved in interpreting what the law says. And so from that, this is more of a policy side of things right now, what's going on, but there will be finance actions that will come down the road, and what those are kind of TBD and based on what where we are with what the VAC would like to see happen. So Steve, why don't you come up here, sit down. It could be a prolonged conversation, at least with a lot of questions, because this is I don't know who writes these bills, but they don't make it easy to interpret. Just say what you mean, type of stuff, and they don't. And so it took some people with different degrees than I have to be able to interpret that, and thank you, Mr. Coughlin, for that. So to start off with, I thought it might be good to and you have in your packet, you have a sheet of paper that kind of lays out what the financial impacts are and what the law says. I'm sorry, I've got to get to the page here. So, and Mr. Coughlin, obviously, please jump in. I don't know if you want to be close to the mic because I definitely don't want to be the lawyer in this. I would like whoever has the legal opinion of what the interpretations are to come from them, not from me. But in terms of the paperwork you see here, ILCS 305, which is the 512.21.13 is what we operate under. Is there a way that could be on the screen? We don't have the packet up there. Okay, that's all right. We didn't have it here, but it is there in front of you. The law was passed this last legislative session, and it takes effect on 1/1. And so, Steve, I don't know if you and John want to take it from here and discuss what the language is, and then John, maybe you could take that part, and then Steve can talk about what that financial is right now for this year, what it looks like, and then what it means starting on 1/1 of next year. So, please, this is kind of freeform a little bit, but we just got this discussion happened yesterday with the VAC, but it's been a longer discussion regarding how they structure their budget and other things like that. So,
essentially, the change in the law was that in the prior law required that the Veterans Assistance Commission be funded by at least 2% or 0.02% of the assessed valuation of the county. You could go up to 3% to be going to the VAC. It also took into consideration whatever the unobligated funds were at the end of the fiscal year. So if the VAC, say, had $200,000 left at the end of the fiscal year, that $200,000 would then be essentially added into the pot to reach the minimum of the 2% or 0.2% of the assessed valuation that would go to funding. The new law takes out the unobligated funding portion of it, in that every year the VAC is to receive at least 0.2% and up to 0.3% of the assessed valuation. It's going to go into a designated fund strictly for the Veterans Assistance Commission, and will then be administered by the Veterans Assistance Commission. What has in the past, well, essentially now what's happening is that it's not coming out of the general funds of the county's taxation. It's going to be a separate line item on the tax bill. Is going to be and will then go to the VAC for distribution to the veterans. After that, the issue right now is at what point in time do you start this? The bill itself takes effect, or rather the statute takes effect on January 1st. we've had some discussion as to whether the issue as to the funding and the unobligated funds and how do you factor in what that total amount is. My legal opinion is that the new process and the taking the unobligated funds out of the pot, so to speak, every year, that starts January 1st, so that funds that are levied and funds that take place and budgets that are made in fiscal in this year would not come under that particular provision. Ms. Smetansky has a different opinion and indicates that she believes that that's not the case. It's not my legal opinion. We did try to reach out. She tried to reach out to an individual from that has presented to the veterans at veterans conferences, but he declined to issue any opinion. And his suggestion is to write a letter to the Attorney General to ask for an opinion, which I can tell you takes a considerable amount of time. So at the moment, the best opinion I have is my own.
Well, it doesn't take the time to send the letter for request. It'll be a year or two before they get back to us.
Correct.
Usually.
Right.
Yeah.
Yes, the issue is not sending it out, but the issue is getting something back.
Yeah.
And generally speaking, they are very hesitant to issue any type of binding opinion. You will almost always get a non-binding opinion.
Hmm. So again, the key is here that when we say levy, we don't do the levy, and from 1/1 we do a levy after that. We're still operating under the current levy that we would have passed. So it would be taxes levied in 23 collected in 24.
Right.
So all this new money that would come from this new law wouldn't manifest until 24. And it was Ms. Smetansky's opinion that it meant we had to pay this starting 1/1 of this year. We have a differing opinion, and based on what the legal side says. So we're going to keep monitoring it, keep working through it. It's not like we're just going to drop it here. But if we and the other part of it is, and Steve will go through these calculations. Right now, the law says we have to do 0.02%. We actually do 0.027%, which is an extra about $145,000 a year, more than the law says we have to, because we believe in the VAC and their mission, and we're funding them at a higher level than the law says we have to. If we were to bring it up to the 0.3%, we can do so without a referendum, okay? But in this time period, if we were to do that, I don't think it's not something I would ever support, because I think the taxpayers need to weigh in on this. If we were to actually levy that, go over the 3%. Because before then it would actually go outside of tax caps and they would see it on their tax bill. So Steve will explain a little bit more about this, but the key is right now their funding comes within the tax caps, within the general fund, okay? That whole levy for tax caps, if you will. A separate fund, but not, under tax caps. If we go to 3%, it goes outside of it and the taxpayers see a new line on their bill. And that's something I think they need to tell us. Even though we don't have to get their opinion, I think we should get their opinion. So Steve will talk about maybe the ramifications and clean up any mess I might have created with that explanation. But please go ahead, Steve, and kind of talk this through a little bit, because this isn't easy to grab. You have to hear it a couple of times to understand what we're talking about on the number side.
Yeah, just to reiterate, the tax cap, so there's a lot of times there's confusion. We cover this once a year. Within the tax cap, you have the general fund, you have highway, 3 highway funds, the health department, the VAC, the regional, the U of I extension, and pension, and the tort fund, all within the cap. So when something tries to, as far as movement within the cap, if you go to fund one thing, it's rob Peter to pay Paul, because it's all within the same calculation, just so we're all on the same page. So
what he's saying is if we spend more money over here, we have to take it from somebody over here.
It's got to come from someone else, yeah, some other place.
That's how it works, tax caps.
So the top portion of this is the current calculation, current statute, as Mr. Coggan mentioned, the 0.02%. The wording is the last known assessed value. The last known is the 2021 rate setting EAV. That number's on the sheet there of $2,191,000,000, and then so the 0.02% of that is a minimum funding, as the state outlines, of $438,319 for the VAC. So it does talk about in the current statute the unobligated balance, which would be, in our terms, the ending fund balance for the VAC fund. Their funds are separate and kept separate in their own fund. So they ended FY21, that's our last known and audited number, of $299,694, and right now within the tax cap we have a draft levy we're working with, during budget time here. And we're looking at funding for the next levy. So it's tax year 22 collected in 23, and that's also part of the discussion as far as what tax year this starts in. So right now we're looking at $284,392. So their total funding for FY23, according to the state statute, the county is providing is $584,087. So that equals out as far as to the last known EAB of about 0.027. So we're well above the minimum funding requirement, but not over the 0.03. So then the bottom section of the sheet is the new statute, and a little bit confusing because it says, if you look at the first sentence there before the first paragraph part of it, where the county board may levy a tax not to exceed 0.03. So there's a little bit of confusion, if you will, in there. And then it does talk about 0.03, and then if you expand out to the entire levy, it can go to also referendum and go as high as 0.04 if the voters were to say yes, we want to fund at 0.04. But it would come out of the new, that 0.03 does come outside of our tax cap, so it would be a brand new line on the on everyone's property tax bill. So just so everyone's clear. What
in
the new,
24.
In 20, yes, as we've learned here today, in 24, not in, So it'd be, the tax bill you'd receive and pay in 24, that would be for the year 2023, calendar year 2023 taxable levels. So the dollar amounts as far as the last known and the funding levels, just as where we know right now, are at the bottom part of the sheet. So I just wanted to explain some of the dynamics and nuts and bolts, if you will, of the change and what it means, with the language change and how that, comes about into reality as far as, the process is concerned as well.
Right. And I thought this was an appropriate place to bring it first, because it begs a policy discussion, about, are we still, I had a thought, and I said, if you want us to go over the 3%, then maybe all the Legion posts could do a petition to ask the county board to put it on the ballot on their behalf. We just don't want to do it, in my opinion. We would like the taxpayers to weigh in on that if they want to see this issue, because I actually think it's a good thing that we fund the veterans at a higher level. But I can't make that decision for however many taxpayers are in the county. We're already getting leveled by property taxes, and even though we can do it, I don't think we should do it. I think we should get their opinion first. That's where I'm starting with. But other people may feel differently. But concurrently, we won't have the funds to increase their budget until the funds come in 24. Does that make sense as well? So that's why I thought we should talk about it here, because we have a budget request that is would require a substantial amount more financial commitment to the VAC. And I don't know that that's really possible at this point, because again, we'd have to take it from another department, and I can't remember what that amount is right now, but it was a fair amount of money. It wasn't a little. We don't want to cost other departments and employees, but we also want to be fair with the VAC. It's a very delicate situation, but timing has been thrust upon us with the budget that was presented to us that the VAC had passed. So we have to work through this a little bit, but as a policy, this is a discussion. We needed to understand this new law and what it meant, and then sooner or later, I mean, it's hopefully sooner, it's going to be a great thing for the VAC. They're going to have more funds, but this is an unfunded mandate from Springfield again, just like the Safety Act is another unfunded mandate. All of these things keep coming, and some may be good ideas, parts of some may be good ideas, but who's left holding the bag? It's the local taxpayers again. So, and those are the decisions we're made with every day. What do we cut to provide this over here? That's what tax caps does to you. And we don't levy the maximum allowed by law like some people out there on Facebook like to say. That's a complete falsehood. Actually, our multiplier went down last year. So we try to be responsible that way, but we also know that just like law enforcement, veterans deserve our full support. So, in my opinion. Questions about this, Mr. Featherland?
Mr. Chairman, this might sound kind of weird. We already have them covered for the next 2 years, right? In our budget, the way we have it now, right? If they're 2%.
It's actually more. It's a 0.027. So we give an extra 150,000 more than the law allows. Yeah.
So
or mandates.
What is the issue then? If they're
it's
funded?
not. It's just timing. We have a difference on timing. That the perception is that this, as far as 1/1, we had to provide that amount of money, and we've already passed a levy. Taxes levied in 21, collected in 22. Taxes levied in 22, collected in 23. So the next levy is 23, collected in 24. We can't go back and change the levy that just expired.
Do we really?
That's our legal opinion. That's where we're all at right now.
I mean, I don't really feel as though it's going to be right to go back to anybody and knock anybody's door and ask them for more money on their tax bills. The money's already there. So
I agree, but let him straighten that out.
Yeah. What we learned yesterday, the chairman of the VAC board, if I'm saying that correctly, had concern because they have new requirements for the veterans, and which was requiring additional expense for them. They did build in a budget and sent us, a budget request of $624,000 bottom line total. I did plug in through the worksheet, with this $284,000 that we're looking at as our draft number for them, along with the estimated fund balance, and they will still have a estimated positive fund balance at the end of next year, approximately 55 to 60,000 roughly. I mean, obviously give or take, So with their needs and what they're requesting, and with the continuation of, the current law until it comes into full effect, there's still funding available for what they need to do at this point. It does bring them lower on the fund balance level, but also there's future funding, additions coming down the road.
So they're only asking us to stay within our budget then, what we have for the budget. The state's saying you got to add more now, or what are they making it sound like you got to do a referendum or something to get it on the ballot?
To go above the 3%, they say we can do as a vote of the county board, we can make it 3%. Right now we're at 0.0. I say 3%, 0.03. If percent, and we are currently doing 0.027. So we're close to that. If we up it any more, then we could do that. But
it goes into our tax cap then.
It goes into the tax cap at this point, exactly. And so we'd have to take it, we'd have to reduce services in another department to fund services in this department. And that's what we're facing right now. There's, people are saying we can't get employees, we got to pay them more. Well, where does that come from? Because it's not like we sell widgets and we can go sell more product to get more revenue. The taxpayers are the ones who are taking it on the chin continually, over and over again. So while I believe in this, we have to do the financial balance and making sure, as I said to Steve, this law basically incentivizes everybody to spend down their fund balances next year to a certain level, because they're just going to be able to go outside the tax cap in 24 and have a much larger bite at the apple, if that makes sense. Because the calculations are all gone, and so they have to have that full percentage. There's no unobligated balance in the language anymore. So they could spend everything down and go out and get the big bite at the apple. I would suggest saving some money. That I wouldn't do it that way, but it kind of incentivizes that. So, and if that it sounds convoluted, we can sit down afterwards and talk about it, but that's the way in practicality it would work.
Okay.
Yeah. And so all I'm saying is if we do want to go to the 3%, I think we need to hear from the community on that.
Yeah.
Because that is going to be outside in 24 when that is collected, and they should have a say in it. And I think primarily the veterans would be the ones who would be able to spearhead that. You know, to be able to, through their posts and everything, to be able to get that petition in our hands saying, look, it's on the ballot, the county board did it, and here's the percentage because the people wanted it, not because 28 people in a room said they wanted it. Does that make sense?
Yes.
Okay. And by the way, I would also be the first to line up and vote for it. So, yes, Mr. Lear.
Thank you, Mr. Chairman. What ballot might this referendum appear on?
It would be either it would be advisory. It's going to happen anyway. It's going to this law it's going to be a separate line. So the question is the amount, really, and the first opportunity would be the municipal. It's really up to them. We're not going to go out there and do that. That's the community would have to bring it to us. You know what I mean? And then we would take the ball and run with it as they so direct. I think that's probably the best way to handle this one, my own opinion. But you may feel differently. Tell me if you do. Anyone else? It's just the start of something, but as we start talking about budgets and long-term planning, this is a curveball. You know, this, and they're going to have a great facility over there. And my really big concern is that this lack of clarity and getting back on the right track would have, kneecapped that effort, and it doesn't look like it is. You know, it looks like that's still, from what Steve said, they're still going to have and their budget includes the new lease and all of those things over there. So it looks like they could make it through this. What's the name of the act that Congress passed that you're going to have a much more business for, Karen? You see the commercials, about the Camp Lejeune Water Act. If everybody signed up, no, I'm just kidding. But what's that angle there too?
It's called the PACT Act.
That's it, PACT Act.
It's called the PACT Act. And I will tell you too, and not to throw more curveballs at you, but in this veto session coming up, there's changes to this MVAA coming. So as much as you think you might have read through this now, no, there's changes coming if they go into veto session.
Maybe.
Yeah, so, but yeah, it's the PACT Act, and we're already seeing it. Hypertension, I know this is like totally above what we're really talking about. Hypertension was added for Vietnam veterans, and since August 10th, I personally have done 10 claims since August 10th, and that seems little, but that's a lot. And so it's just the start of it. It's just going to be a crazy thing for us. We are swamped.
And so are the feds sending any more resources your direction based on this new law?
Not yet, but there is, in federal government, there is a thing called the CVSO Act, which doesn't actually stand for County Veteran Service Officer, but where they could send funding to county offices. So that would be really nice too. So if you see that going through, please feel free to back that also.
Any questions about any of this? I guess more to come, but the budgetary implications are something we had to really work through, because it caused me pause to think that, wow, is this whole thing going to go sideways? And it doesn't seem like it is for this year. And I think the following year, the only thing and again, this is your area, they run their own board, is cash flow. It may impact cash flow in the 23 year. That's the only major impact, but the following year, they should have a new levy, and, well, until the first collection, actually. So cash flow is an issue. So, any other thoughts? Steve, did we cover it?
Yeah.
Okay. All right.
Can't think of anything.
Mr. Lear?
If I understand what has been presented, in order to keep things going the way we think best, we need to stay under 0.03. Is that correct?
We could go up to the 0.03, but it has tax cap implications.
Yes, I
so we'd have
understand
to where we're at, we're not stealing from we're not taking the budget of another department to support this. Okay, everything is still kind of the way it is, and we're still increasing funding. We go to the .03, then we have to start moving things around, you know, from other departments into this one. And I'm not sure that that's something that we're ready to do right now.
Okay.
But that would be a vote of the Finance Committee and the full board.
Okay.
Yeah. That's what the reality of tax caps. In order for you
Yeah,
to,
I
in order
understand
for
the
someone to win, someone's got to lose within the tax cap. So I hope you see this is a good thing down the road where it comes outside the cap, because then it's a direct, you know, funding mechanism that doesn't impact and gets us away from that. And I think that might be part of the intent of why this law is here, because it probably kept happening over and over again. Much like mental health, usually the veteran services get pushed down the list. And we end up being the worst state in the union as far as that goes, in both. So, any other thoughts, questions? Mr. Hunter.
Thank you very, very much, Mr. Chairman. Karen, what initiatives have you taken to pursue soft money in terms of grants?
None. So grant funding is not at the top of our list. And I'll just say, 1, timing. 2, I don't have a grant writer. And yeah.
Well, do you really necessarily need a grant writer per se to secure certain funds? I mean, you or your staff don't have the ability or the expertise to identify potential resources externally other than the county to effectuate and enhance the delivery services for your veterans?
So, boy, that's a long question. So,
no, it's not really.
You know, well, so it is only because, 1, right now the levy covers us. 2, is it possible? Yes. 3, I don't have the time, and neither does my staff. We really are swamped. We book about 2 to 3 weeks out on most of our appointments, and that is a lot. Like, veteran services are at the top of our game, and to spend time writing a grant and doing that, taking that away from doing the veteran services is difficult.
Had you ever thought about utilizing interns to pursue additional funding, or interface with KCC or Olivet or Governor State?
We've used work studies through the VA before. Absolutely, those type of people have helped us out. Right now, we've not had any luck with any work studies from any of the places. Right, usually we use KCC, but they don't have any available right now. Hopefully, with the new term that just started, we'll find some. But so far, we haven't had any.
Okay.
Anyone else? Okay. Thanks, Steve. Appreciate it. More to come. We'll give updates as we get. As far as we're operating now, this interpretation is what we're operating, absent any other updates from any other legal source. So we'll still keep pushing and keep working through it. County Administrator report, Anita Speckman.
I am really a rather short, I hope, report today. I just wanted to let you know there are currently 14 open positions. It's kind of a misnomer because probation remains at 3 openings, so it's total 16 people. But of that, 50% of those positions are not hired by county administration, or we don't get involved in those. In other words, state's attorney, mostly 5 of them are public health and public health and state's attorney. And then there's a new land bank manager position for the Kankakee County Land Bank. Am I saying that correctly?
Kankakee Regional Land Bank.
Okay. Kankakee Regional Land Bank, which we have posted and distributed by our typical methods. But it's not something that our offices are involved in other than our EEO tracking. So that's kind of where we are. It is an uptick, but again, it's a bit of a misnomer. The last time we were at 16 was August of 2021, but at that point, there were no public health openings. So it was more of our core county departments, which it isn't now. So let's see, other than that, I continue working on collective bargaining agreements. We're going to bring the corrections tentative agreement to the finance committee tomorrow, and our legal representative will be here to discuss that with the finance committee. Coroner remains in progress, although we are optimistic we are getting close to resolving that situation. Highway and maintenance are next up. I just, while I was sitting in the back, received a tentative start date for the maintenance negotiation, so I'll work on trying to schedule that. We've got our committee members identified, so we're gonna move forward with trying to get that scheduled. Trying to get on the attorneys' calendars are typically the most difficult piece of the pie, so I'll get that taken care of. Group health overview is tomorrow with Mike Lynch looking at 2023, and the renewal application for property liability work comp, that all was submitted on September 14th to get our renewal, and we did a claims review at that point as well, which we do with our insurance representatives, and we actually go through our open cases and discuss where we believe we've got exposure. So that's kind of their piece at looking at renewal when they look at concerns with what costs might be related to open claims and looking at that. I did reach out to our representatives at the insurance company to ask about what they think it's going to look like, and I didn't get a response back, so waiting to hear for that. So I think that's all I have, unless there are any specific questions.
The brevity of the presentation belays the amount of work it takes to get each one of those things done. I'm sorry. It sounds easy when you hear it on paper, but
hours.
It's everything is very well. I'm going to say it's fun because it's challenging, but at times it's not fun and it's very involved. But we're making a lot of progress. These are pretty heady things we're doing. Any questions on anything specifically? Yes, Mr. Fairfield.
I'd just like to thank Anita for all her hard work.
Amen.
Thank you. Okay. All right, I'm gonna leave that.
In lieu of a raise, no, I'm just kidding. You get a hearty thank you. Under administrative, I have some reappointments here. Looks like it's drainage season. Take a deep breath. Yes, sir.
Thank you, Mr. Chairman. Do you have to be a resident of the county to be appointed to a drainage district?
You have to own property in that area.
Thank you.
Yeah.
Okay. All
Yeah.
right.
Yeah.
There was a question about one of the appointees. I'm not going to say him by name, but
sure.
Home address is not in the county.
Exactly.
Thank
Yeah. I had the same question a while ago. Yeah. It's we look. That was a couple years ago. I had that answer. Sorry.
Thank you, sir.
Yep. Okay. Reappointments. Whew. Deep breath. Harold McQueen to the Manteno Drainage District number 3. John Grecius, Grinnell Special Drainage District. David Wolf, Grinnell Special Drainage. Orville Joe Deno to the Gar Creek Drainage District. Keith Yonka, Baker Creek Drainage District. Jude Pommier, Baker Creek Drainage District. David Cole, Canavan Drainage District. Roger Keir, Rockville Drainage number 1. Nicholas Sadoff to the BM Lewis Drainage District. Paul DeGroot, Clausen Park Drainage District. Gerald Wagner, Raymond Drainage District. Jason O'Connor, Raymond Drainage District. Mark O'Connor, Joe Bennis Drainage District. Tom DeYoung, Little Beaver Special Drainage District. Mark Provost, X-Line Creek Drainage District. Roger Blanchett, X-Line Creek Drainage District. Leroy Bauer, McGilvery Drainage District. Steve Engelking, Yellowhead and Washington Union Drainage number 2. Brian Grob, Pilot Township Fire Protection District. Dennis Bonvalet to the St. Anne Fire Protection District, and Andy Wegner to the Animal Welfare Advisory Committee. And those are all reappointments, and we have one appointment of Iris Sneed to the Regional Planning Commission. Can I get a motion to combine and approve those? Mr. Miller, Mr. Long with a second. All those in favor say aye.
Aye.
Those opposed, same sign. Motion carries. Mr. Miller, that rounds out at 12 members?
11.
Well, we had a discussion. Mr. Sneed would be the 12th, and we were going to amend it to full board because we don't need to have an even number, and we had this application in process, so rather than penalize him, we were going to ask the board to go to 12, to have just as an amendment. I thought that was fair, you know, because he was already had his application in process. He wants to be part of it. So the key is that the quorum number did not change by adding the 12th, correct? All right, just want to draw, yeah, exactly. We still have the same quorum requirements per their bylaws, so. But again, we'll tackle that in full board. I'll ask for the amendment there so we can do it. Openings, one opening on the following: Moments Pembroke Union Drainage District, number 1, Moments Yellowhead Drainage, number 1, Gar Creek Drainage District, Mantino Drainage, number 3, McGilvery Special Drainage District, Baker Creek Drainage District, and one opening on the Kankakee River Conservancy District. We had that person reapply, but we didn't announce the opening, so we're going to announce it and then go next month with the application. So people can still apply, obviously, and we can decide, but we have to post it first. We just can't have it out there.
We didn't vote on the appointments or reappointments. I don't.
We didn't? We got the motion in a second?
We got the motion in a
I
second.
don't remember, no.
Did we
There's
all
a
vote?
motion and a second.
We voted. All in favor, say aye.
How about we do it again? Just, I think we did, but all those in favor say again. Again.
Back in the room didn't know.
I only got 4 ayes a meeting. You're up.
We're at least we're covered now. Thank you. Insurance. So those are all the openings on that we have. Any new business? Sorry. Totally threw me off the rails there, Todd.
Sorry.
Old business. And is there a motion? Yes, sir.
To adjourn?
Polk.
Second by Ms. Polk. All those in favor say aye.
Aye.
Those opposed, same sign.